Hey everybody, welcome back to Pick Dr. Osborne's Brain. It's another great episode for you tonight. We're going to be talking all about vitamin K. Now, if you are taking any type of blood thinning medication, if you've been on any antibiotics for any length of time, or if you have a prior diagnosis of epilepsy and you've been on a seizure disorder, pay close attention to this episode today because I'm going to be talking about how those particular medications for those particular conditions can actually create a problem for you. Now, before we get started, if you're new to the show, make sure you say hello. Let me know where you're tuning in from, what part of the globe that you are watching the Dr. Osborne show, and then we will get started. So, again, tonight, all about vitamin K, a crash course, if you will, on what you need to understand about vitamin K. Now, vitamin K is unique in this regard, like many of the other vitamins. So we have vitamins that are classified in two different categories, basically fat-soluble and water-soluble. And vitamin K is in that fat-soluble category, along with vitamin A, vitamin D, and vitamin E. So when you're thinking in terms of vitamin K, it's fat-soluble. Very, very important to understand that. Now, a lot of doctors will tell you from that perspective that when you're talking about fat-soluble vitamins, not to take higher doses of them because there's a greater risk of toxicity because fat stores in the body. And that actually is not true at all with vitamin K. There's actually no known toxicity level of natural forms of vitamin K. That's, again, vitamin K1 and vitamin K2, which we'll get into here in just a moment tonight. So let's talk about some of the functions of vitamin K so you can kind of understand what this vitamin does, why it's important in the body. So one of the biggest functions is in blood coagulation. What does that mean? That means it helps your blood to clot. If you don't have adequate vitamin K, your blood won't clot adequately, and that can create some really serious side effects and problems. So vitamin K is necessary to help what's called your blood clotting cascade. In essence, again, helps your blood to clot. Vitamin K is also important in the mineralization of bone. So it helps to put minerals into your bone instead of putting them in other places. So mineralization of bone, it's been shown to actually also help in not just with bone, but also with cartilage and with the dentin in the teeth. So it's important not just for bone. A lot of people talk about vitamin K in the bone, and actually in Japan, vitamin K, certain derivatives of vitamin K are actually used and approved as a drug to treat osteoporosis, but also helps with cartilage formation, also helps with dentin production. Now, one of the other functions of vitamin K is that it prevents, just like it helps to put minerals in your bone, it prevents mineralization of your soft tissue. What does that mean? Well, I'm going to put a picture up here on the screen for you and kind of give you an example of kind of a classic example of what I mean by this. So what you're looking at here, you're looking at two different images. One on the left side of the screen is a vitamin K deficiency. And what you're seeing there is the lining of, or the inside, or the lumen rather, of a blood vessel. So if you're looking down a blood vessel, you can see when there's enough vitamin K, there's nice round blood vessel. But if you look at that picture on the right, there's a lot of debris and a lot of mineral deposits, if you will, being laid down in that blood vessel, creating a thickening effect of the blood vessel. So a lot of people with atherosclerosis, for example, we now know that vitamin K helps to prevent calcium deposition in blood vessels. Well, that's an example of vitamin K's function in preventing mineralization of soft tissue. Your blood vessels are a form of soft tissue. So we don't want calcium deposits. We don't want mineral deposits going into locations they don't belong, and your blood vessels certainly one of those locations. So again, one of the functions of vitamin K is in the prevention of mineralization of your soft tissue. Now, there's another newly discovered, I say newly, in science it's new. It takes 30 plus years for new scientific discoveries to really make it to mainstream knowledge. But in 1993, it was discovered that vitamin K was important for growth and growth regulation of cells. So it helps to regulate the growth of cells. In that regard, it has some anti-cancer and cancer controlling impacts. So We're going to be learning a lot more about this as the research unfolds, but it's been shown that vitamin K actually helps with a particular gene that helps to regulate the growth of cells and the differentiation of cells. We know the same thing is true of vitamin A and of vitamin D. Now we know that about vitamin K as well. So these are your primary functions of vitamin K. And so understanding this now will help you understand what some of the symptoms, why some of the symptoms and some of the diseases with vitamin K actually happen. So let's kind of break some of those down. Remember I said earlier that the function of vitamin K is in blood coagulation? Well, the deficiency of vitamin K can manifest in a number of different ways. And one of those ways is through easy bleeding, right? So we can get easy bruising. So bumping up against a wall and you bruise very, very easy, or your blood pools underneath the skin, creating like a blood pool. You'll see this a lot in elderly people who are on blood thinning medications where they have big patches of red on their skin. That's blood pooling underneath the skin because they're blocking vitamin K with that medication. Nosebleeds. If you have spontaneous nose bleeding with no absolute no reason or no trauma, like you didn't get punched in the face, your nose just starts bleeding, that could potentially be a vitamin K deficiency. Bleeding of the gums can be a vitamin K deficiency. Blood in your urine, blood in your stool, black tarry stools. If your stools are coming out and they're really tarry and really black, that could be a sign as well of vitamin K deficiency. Some people end up in the hospital with internal hemorrhages, and that's their diagnosis, right? That could be a vitamin K deficiency as well. So again, any of these things happening. Now, if you get a cut, excessive bleeding, also on the list. So if your cut won't clot, in essence, if your blood just keeps running, this could be the potential for a vitamin K deficiency. Now I'm going to stop there for just a minute because many of you take probably a lot of different types of supplements, and you should be aware that there are a number of different supplements that will thin your blood. And if you're taking them, I don't want you to confuse them for a vitamin K deficiency. So what are some supplements that thin the blood? Simply put, fish oil is one of them. So if you're taking 3 or more grams of fish oil a day, that can thin your blood. Ginkgo, if you ever take ginkgo biloba, this is one that can thin the blood. Magnesium can thin your blood as well. Vitamin C can thin the blood. So you've got a lot of different nutrients. If you're taking higher doses or mega doses of those particular supplements and you're bleeding and you find yourself bleeding a little bit more prolonged, then before you jump to vitamin K, also think about what you're currently taking. Now, some of you may also be taking medications that thin the blood. And so in that regard, one of the most common one that gets prescribed is aspirin or salicylate. And this includes the supplement white willow bark. So if you're taking a natural version of aspirin, acetylsalicylic acid, it can thin your blood as well. And so, again, you got to keep in mind if you're on those things, you don't want to just necessarily jump to a vitamin K deficiency in your thought, in the process of your thoughts. So keep that in mind. So these are all kind of a breakdown of if you do have easy bruising, if you are having your gums bleed or having blood in your stool or blood in your urine, and you're taking these types of supplements, again, pay close attention to that and don't just jump right to vitamin K. You could also have an overdose of something else. So just keep those things in mind. Let's talk about where you get vitamin K in the diet. So vitamin K comes from a number of different sources, a number of different foods. Predominantly, the biggest source or the best source of vitamin K is actually what we call vitamin K1. And this comes in dark green leafy vegetables. Now, there's 3 different forms of vitamin K. There's vitamin K1, there's vitamin K2, and there's vitamin K3. Now, vitamin K3 is synthetic, so none of you are probably using this. It was shown early on to create some health issues for people, but most people are getting either vitamin K1 or vitamin K2. Now, vitamin K1, this is your dark greens. So if it's green, if it's got chlorophyll in it, for example, kale, extremely rich in vitamin K1. So is spinach, mustard greens, beet greens, chard or Swiss chard, one of the best sources of vitamin K, per gram. As well, broccoli, green tea, asparagus. Again, if it's green, it's got vitamin K1. Vitamin K1, also known as phylloquinone, is the plant-based form of vitamin K. So generally speaking, if you eat a lot of your greens, you don't have to worry about vitamin K1, although it has a relatively short half-life and it doesn't store very well in your body tissues. You need an ongoing source of vitamin K. Now, for those of you who maybe there's two different parties that are out there right now. There's vegans, which you don't have to worry so much, and then there's the carnivore crowd, or the crowd that's higher in meat eating. And so you can also get vitamin K in animal products as well, but not K1. You can get vitamin K2. Now, vitamin K2 is richly found in things like cheese. It can be found in eggs. Again, if the organ meats like liver tissue can contain a little bit higher doses of vitamin K2 as well. So again, if you're eating animal meat, you're going to get some of that K2 within those foods. Most of our vitamin K2, though, internally, if we're eating greens, is converted into vitamin K2 through bacterial action. So the bacteria that live inside your intestines can and have the ability to convert K1 to K2. So if you're getting plenty of K1 in your diet, you can convert it into K2 if you have adequate gut bacteria. If you don't have adequate gut bacteria, now you may have a problem. And so food sources might be a better option for you, but maybe even a bigger and better option is what could you eat in your food that would help your bacteria. So there are some other food sources of vitamin K that are going to be part of this K2 family as well, and that's fermented foods. So we look at things like fermented sauerkraut, fermented soy. Some people eat natto, which is a fermented soy product. It's very, very popular. So, fermented based food items can also contain vitamin K2, as those bacteria that ferment the greens ferment it into a K2 that you eat when you eat those fermented foods. Now, I do not recommend, for example, something like a kombucha, which is largely fermented with sugar, and it's basically like drinking sugar water. It's not very good for you. I know it has a popular health connotation, but it's not something that I recommend at all to get your vitamin K. So again, we've got a number of different food sources and food possibilities here. Let's go back to what causes vitamin K deficiency. I kind of took a kind of a turn off there earlier, or a minute ago, when we were talking about blood thinning, but I want to talk about some of the causes. Now, one of the things that will cause a vitamin K deficiency is just a poor diet, a highly processed food diet. So if you're not getting in these rich greens, or if the types of animal products that you're eating are feedlot animals, you're not going to get as rich of a source of vitamin K from that type of food. So an inadequate, highly processed food diet, not a good idea. If you have pre-existing inflammatory bowel disease, this can also create or set you up for vitamin K deficiency, more specifically because that inflamed bowel is damaged. And we'll see most of the time people with inflamed bowel and inflammatory bowel disorders have bacterial problems in their GI tract. So you've got two problems there. You've got one where you might have a bacterial imbalance that's leading to a poor conversion of K1 to K2, but you also have damage to the intestinal lining, which again can manifest as not absorbing vitamin K adequately, or not absorbing enough of that vitamin K that you're eating. So inflammatory bowel disease is a big part of this. The other thing that we might see, and let me make a little bit more room, is liver disease. So if you've got a history of hepatitis, for example, or a biliary problem, any of you that have had your gallbladder removed, and that's pretty common surgery nowadays. Doctors kind of take out gallbladders the way they used to take out appendixes. They would just tell you it's an old organ, you don't really need it, let's just remove it so that your symptoms go away. Bad idea. Removing the gallbladder is a terrible idea unless it's acutely infected and threatening your life. You need your gallbladder. Remember earlier I said that vitamin K is fat soluble. And so what does that mean? It means that you need to absorb it, you need to be able to bind it or emulsify it with bile. Your gallbladder produces, or doesn't produce, your liver produces bile, but your gallbladder secretes the bile into your small intestine. And then the bile salts, what they do is they bind or they emulsify vitamin K. And when they do that, it turns vitamin K into a water-soluble substance that can now be properly absorbed across the intestinal lining. So in essence, you've got to have a functioning gallbladder, you've got to have a healthy liver to be able to properly secrete the bile acids to emulsify that vitamin K for the proper absorption. If you don't have a gallbladder, this process becomes hindered. If you have a hepatitis problem where you're not properly producing bile, this process can also be hindered. If you have a history of gallstones where you have stones that precipitate out into your gallbladder, this can inhibit your possibility at absorbing properly vitamin K. If you have, again, if you have a problem with your liver or your gallbladder, it can cause, as a secondary side effect, vitamin K deficiency. So it's smart, if your vitamin K levels, if your doctor runs them and they come back low, it's smart to ask, is my liver functioning well? Do I need to run some liver function tests to determine whether or not I have a problem with my liver? So there are a number of different liver function tests in that regard that, very commonly doctors will run. One of them is called AST, another is called ALT. There's another test that measures something called bilirubin. These are very, very common blood tests that doctors will measure to get a general idea of whether or not your liver function is compromised. And so if you are, again, struggling with a gallbladder issue, these are some tests that are pretty simple. Most doctors can do. Insurance will cover these types of tests to help you determine whether or not your liver's functioning. Because if your liver's not functioning, likelihood that you're not adequately producing bile means that you're going to malabsorb vitamin K. Now, you'll also malabsorb vitamin A, D, and E, as well as omega-3, because remember, bile acids are necessary for fat absorption. So no matter what fat it is that you're eating, whether those fats are vitamins or whether that fat is just the macronutrient fat itself that your body's trying to absorb. So if you've got a biliary problem, which is basically gallbladder disease, biliary problem, or a gallbladder removal, or if you've had gallstones, or if you've got hepatitis, you're at risk for the potential for vitamin K deficiency. Now, another thing that can cause vitamin K deficiency, let me box this out for you, is, in a nutshell, is dysbiosis. Now, dysbiosis is referring to abnormal bacteria or an imbalance in the bacteria that live in your GI tract. So remember what I said earlier, these bacteria, it's thought that the good bacteria in your gut produce about 50% of your daily vitamin K. That's quite a bit, 50%. So again, if you're eating lots of greens, and those greens are, as they're coming in, your bacteria will convert a lot of those to K2 and create a lot of vitamin K for you for absorption. So again, part of your vitamin K is brought in through green leafies. The other part is actually produced by your good bacteria. So if you're struggling with chronic conditions like SIBO, small intestinal bacterial overgrowth, it's just a form of dysbiosis. Or if you have low levels of healthy beneficial flora like lactobacillus or bifidobacteria, those things can contribute to a vitamin K deficiency. If you've had a history of antibiotic use, antibiotics, remember, you're knocking out your flora. The antibiotics are not specific to one type of species. They're generally broad spectrum, so they will wipe out large quantities of good, healthy gut bacteria. That's now being shown that just one dose of antibiotics can disrupt your gut flora for up to 2 years. So if you're ever in that position where you're thinking about an antibiotic or not an antibiotic, here's the question I would encourage you to think about. If your life is in jeopardy, take the antibiotic. If your life is not in jeopardy and the doctor just thinks it might be a bacterial infection, you might just consider waiting or getting a second opinion, right? Because antibiotics can knock out your capacity for vitamin K. Now, if you're on blood thinning medications, particularly the Coumadins, so this would be something like warfarin, or Coumadin, these medications that thin the blood, they actually thin the blood by blocking vitamin K. Okay, so that's how they work. They are direct antagonists to the formation of the way that vitamin K works. Vitamin K actually, there's a process called the decarboxylase process where vitamin K activates a different proteins, and it activates your body's ability to clot your bloodstream. And so when you're taking a Coumadin or a warfarin or one of these anticoagulant medications that are found in that family, you're actually directly blocking how vitamin K does its job. Now, many people take these medications, and you may be listening, and you may be one of them. And if you are, probably your doctor has told you don't eat leafy green vegetables. Your doctor's probably told you to avoid anything green because they don't want that vitamin K interfering with the drug that they're giving you to thin your blood. If that's the situation that you're in, I would strongly encourage you to get a second opinion. Not a second opinion as to whether to eat vitamin K with warfarin, but a second opinion as to whether or not you should be thinning your blood for the rest of your life to reduce your risk of recurring stroke or a heart problem. Remember, most people are on these blood thinners because they've either had a heart attack or a stroke, and the doctors have said, we got to keep you on these blood thinners relatively for the rest of your life or for some extenuated period of time, right, as a result to thin your blood. That's one thing if you've had a life-threatening clot and you're on it in the short term, and there's like a game plan and an action plan, and that doctor is monitoring your clotting time and saying, okay, at a certain point in time, we want to kind of wean you off this medication and really work you back toward not needing it. But if you've just been told that you need to be on that blood thinner for the rest of your life, this is why I highly encourage you to get a second opinion, because remember we talked about a minute ago the functions of vitamin K, and we said that vitamin K deficiency can cause bone loss. It can cause heart disease, right? And the very thing that a lot of times when doctors are giving you blood thinners, they're trying to prevent a heart problem or a vascular problem. Well, not having vitamin K adequately can calcify your arteries. It can calcify the different blood vessels in your body, and it can make them rigid and stiff, and that will elevate your blood pressure. And elevated blood pressure increases your risk for stroke. It increases your risk for heart attack. So if they're trying to reduce your risk of stroke and heart attack by thinning your blood, but by thinning your blood, they're actually causing the deficiency or inhibiting a particular nutrient that actually reduces your risk of heart disease, you have to ask the question, are you getting ahead or are you spinning your wheels in the mud? So that second opinion is important. Remember earlier I wrote on the board, I said there are a number of different things that can naturally thin the blood. So what are those things? Not warfarin. Warfarin actually was originally created, it was a rat poison, and it was discovered that that's how it worked. But we said earlier that essential fatty acids, so omega-3, particularly omega-3 fatty acids, can thin the blood. Magnesium can thin the blood. We said that ginkgo is another one. Ginkgo is another one that can thin the blood. We've got other, and ginkgo's more of a drug-like effect. So really, if we're talking about like natural things that can keep the blood viscosity thinner and inhibit the blood viscosity from being overwhelmingly too thick. Whoa, what about exercise? Exercise can keep the blood viscosity thin. So there are a lot of choices that you have nutritionally. I mean, these are just a few. And then physically, exercise being one of those that can improve your circulation, your microcirculation as well. So that's what I mean by having a second backup plan. It's like, don't be here forever. Like, start talking and discussing some of these strategies with your doctor. And if they're not monitoring your blood viscosity, what I mean by that is there's a couple different tests that commonly get run. One is called PT, prothrombin time. And it's a measure of how quickly your blood clots. And then there's a calculation that they'll derive called an INR calculation. So these things should be being measured. And my advice to you is if you've ever been told that the doctor wants to thin your blood aggressively and they're not measuring these, then ask for them to measure those, and then ask for some of these things and continue to measure so that you can potentially at some point in your future get off the poison and use vitamins, minerals, nutrients, and diet and exercise and lifestyle change so that your blood viscosity is not too thick. Remember, there's a reason for most people when they have a stroke or a heart attack, there's a reason why that happens. If their blood, and if it's happening because their blood is too thick, there's a reason why their blood is too thick. And that reason is generally not because they have a blood thinner deficiency. The reason is because they're doing other things wrong in their diet and lifestyle. Remember, highly inflammatory foods causes an increased viscosity in your blood. Too much sugar can increase the viscosity of your blood, or can make your blood thick and syrupy and sticky. So you've got to change your diet, change your lifestyle, exercise, eat the right foods to keep the blood viscosity nice and thin. Therefore, if you do that, you won't ever have that need to stay on those for a long period of time or long term. So again, if you've ever been put on those medicines, you need to have that conversation with your doc and get that second opinion. If you've ever been diagnosed with epilepsy, seizure disorder, and you're taking hydantoin types of medications, look at your medication. If it ends in TOIN, that's a hydantoin anti-epileptic medication. But that type of medication also interferes with vitamin K. So if you're on anti-seizure medication, know that you're inhibiting vitamin K, running the increased risk of heart disease, running the increased risk of bone loss, and running the increased risk of internal bleeding. So we don't like those. If you're taking a type of medication called a bile acid sequestrant, these types of medicines are alternatives to statins. If your doctor's wanting you to lower your cholesterol, and a lot of people, they'll go in and they'll say, no, there's no way you're going to get me to take a statin. And so the doctor will pull out a bile acid sequestrant instead. These are different types of, again, of cholesterol lowering medications. They lower cholesterol through bile acid sequestering. So they basically bind bile acids. These types of medication, remember what I said up here earlier, if your bile acids are not being properly secreted, or if you are binding them, then you are going to reduce your capacity at absorbing fat. Vitamin K is a fat. So it's important that you understand, if you're taking that medication, you're also running the risk of increasing heart disease and bone loss and cancers, among other things. By binding on to those bile acids, you're inhibiting that vitamin K and the functions, therefore, of it. Other things that can bind or kind of interfere, we mentioned earlier aspirin. We'll write it down here. Aspirin can interfere with blood clotting. And so again, it's one of those that oftentimes get used as a blood thinning agent, but it's been shown to can interfere with vitamin K as well. And then there's a food additive that used to be more popular in like I think it was the late 80s or 90s. You may remember it. It was called Olestra. And it was a fat substitute. You remember when everything was going low fat, no fat? And so the food chemists it was a mad dash to try to create foods that had the kind of mouth texture, feel, and taste of fat. And Olestra was one of those. And it was used, and it might still be, in a number of different processed products. I would look for that because this particular type of agent is known to bind fat. And so it can bind onto that fat and cause you to malabsorb or to not properly absorb fat as well. So if you are eating high doses of Olestra through processed food items, again, you're potentially inhibiting your capacity at absorbing vitamin K. So, okay, I think we covered most of the things on the list. Let's jump into forms of vitamin K. So there's three, I said earlier, there's three main forms of vitamin K. There's vitamin K1, there's vitamin K2, and there's vitamin K3. Now, the vitamin K1, also known as phylloquinone, is a type of vitamin K found predominantly in the greens. So we talked about that again here, and then we've got vitamin K2, which is Minocqua Known. And there are a number of different forms of Minocqua Known. Generally, there's Minocqua Known. You may have looked at a supplement and seen like MK in the abbreviation. So if you see like MK4 or MK7, and there are a number of different, I think it goes all the way up now to 15. These are just different derivatives of vitamin K2. For some of them, like MK7, rich in fermented soy, richer in MK8, richer in sauerkraut. So again, some of the fermented foods have different types of Minocqua, but that's what MK is indicative of. It's just saying that the MK aspect and then the number that follows it just represents the length of the side chain on the molecule itself. So you'll see a number of those different derivatives, and a lot of supplement companies produce, like MK7 is a very popular supplement, MK4 is a very popular supplement, and these are the reasons why. Like I said earlier, part of the reason why they break down these into different forms is some of the newer studies coming out show that some forms are better absorbed than others. I think the verdict is still out on a lot of those studies. Nothing is really super definitive. My favorite way to get vitamin K is eating it with real food. But supplementation can also be done. So if you were doing supplementation, you could, but my advice would be don't high dose vitamin K unless you absolutely need to. And in that regard, make sure you get lab testing done that kind of measures, whether or not you have the potential possibility at having a vitamin K deficiency in the first place. And a simple test that people can do is called a prothrombin time. I mentioned that earlier. It's just measuring how fast your blood clots. If your blood is not clotting at adequate speeds, then there's that very, very real potential that you could be vitamin K deficient. Now, that could also mean you're calcium deficient, because calcium also plays a role in the coagulation of blood. So although PTT testing is not specific solely for vitamin K, it can give a pretty good indicator as to whether or not it might be a potential part of the possibility. Additionally, you can have intracellular vitamin K levels checked, and that's another really good way to measure vitamin K levels to determine whether or not supplementation might be adequate for you. I want to back up some of the additional, we didn't get into some of the diseases. There was one particular topic. If we go back up to, there's a slide I have, Mel, on diseases linked to vitamin K deficiency. I want to talk a little bit, because many of you have asked the question. We actually get this question quite frequently. Newborn babies are being born in the hospital, and the doctors want to inject them with a vitamin K shot. Used to be that shot was a synthetic version, is vitamin K3, but it was found to cause liver damage and potential jaundice and other problems. And so now at birth, they're injecting a subscription or prescription vitamin K1, about a milligram they're injecting into babies, 1 to 2 milligrams, depending on the doctor, depending on the hospital. So there's a condition called hemorrhagic disease of the newborn, and that's when a baby is passing through the vaginal canal being born. If vitamin K levels are really, really low, then what can happen is that baby has that potential, that risk for a hemorrhage, an internal hemorrhage. And this is why doctors like to give that vitamin K shot directly after birth. Now, I'm not a fan of sticking a needle in a freshly born baby. The research, though, is pretty solid that giving vitamin K does reduce the risk. But what is the actual risk? You get to make that decision as a parent. But my advice is, if you're not going to do the vitamin K injection at birth, that you consider oral vitamin K supplementation with babies. And you can do that in the form of vitamin K1 or vitamin K2, but the dosage or the quantity needs to be about 1 milligram, 1 to 2 milligrams at birth, and then about 4 days later do that same dose, about 1 to 2 milligrams, and then 4 weeks later do that same dose again, so that you're making sure that baby has enough vitamin K. Where we really see the increased risk is when the mom is on a medication that inhibits vitamin K. Like if mom has a seizure disorder and she's been on an anti-epileptic medication, a hydantoin epileptic medication, then she's going to have already a great risk of being vitamin K deficient. And understand that vitamin K doesn't pass through. There's not a lot of vitamin K in breast milk, and so this is why a lot of times the hospitals are going to want to inject the baby with vitamin K. But I thought I'd cover that because, again, it's a question that we get on a very, very regular basis. So now I want to open up the floor for any questions that you might have about vitamin K. So we're going to pull up our question list here. Okay. So first question, I have raised ALT. We talked about that. ALT, alanine aminotransferase, is what that stands for. It's a liver enzyme. When you have raised ALT, it can mean a couple of different things, Nancy. It depends. What can you do? Depends on why it's elevated. ALT can be elevated because of aggressive exercise, but it can also be elevated as a result of liver damage. So I would get better clarity. You might have your doctor run a liver ultrasound test to see if there's any type of visible inflammation or visible fatty infiltrator storage in the liver. And then what can you do? You got to figure out why that's happening. For most people, what damages the liver if they're not consuming alcohol. Alcohol is number one, but if you're not consuming alcohol, one of the biggest variety of factors that I've seen damage the liver are processed foods, highly processed foods, foods loaded with sugar, as well as foods loaded with gluten. So if you haven't gone gluten-free, remember that gluten is one of those known causes for autoimmune hepatitis, meaning it can create liver damage even though you don't drink alcohol. So that is something I might ask my doctor to look into as well. Let's see. Jen says, my 10-year-old daughter has I'm going to assume that means a vitamin D level of 33. Is that good? She had dermatitis herpetiformis before stopping gluten. She has a very high ANA titer. Yeah, I mean, Jen, if her vitamin D level is at 33, it's too low. If you're talking about standard measurements, it should be at least 50 to 70 as kind of an ideal, but really probably even more like 70 to 100 because of her history of autoimmune disease. And that positive ANA titer means there's still some type of autoimmune reaction. So Jen, if you don't know about the True Gluten-Free Diet and have not read No Grain, No Pain, I highly encourage you to pick your copy up and read it. The chapters on diet, chapters 7 and 8, because your daughter might not be on the appropriate gluten-free diet to really institute and really get her the healing that she needs. So that might be something that helps her go a little bit further in her process. The calcium I take has K2 along with magnesium. Is that good? I've been diagnosed with osteoporosis. It's indifferent, Linda. It's good. A lot of people will say if you're going to take calcium, take vitamin K, or if you're going to take vitamin D, take vitamin K with it. I'm going to say if you're going to take high doses of any type of supplement like that, get tested to determine whether or not you're taking those high doses for a reason or if you're just taking them to feel better about something. But it's indifferent. Does vitamin K affect vitamin D absorption? Yeah, they kind of competitively inhibit or compete with each other, Michelle. So vitamin K, vitamin D, vitamin E, and vitamin A all kind of compete with each other, although there's some research showing that vitamin D and vitamin K given together do have a synergism. If you take high doses of vitamin D, you can inhibit vitamin K. If you take high doses of vitamin K, potentially you can also inhibit vitamin D. And we also know this is true of vitamin A. Super high doses of vitamin A over long periods of time can inhibit vitamin K absorption. Same thing with vitamin E. Not only can vitamin E compete with vitamin K for uptake in the small intestine, but vitamin E has actually been shown in some research to actually inhibit vitamin K's activity with the enzymes that it's responsible for helping your blood coagulate. So vitamin E kind of can affect both the absorption, but also the function of vitamin K. So and that goes with any fat-soluble vitamin. If you're going to take any of them in high doses for really long periods of time, you need to be making sure your doctor's measuring your levels so that you don't create a problem somewhere else. Okay, let's see here. Does vitamin K also help with removal of plaque from arteries, or what does? Phil, there's no compelling evidence or research that I have seen. It doesn't mean it can't happen or it won't happen, but there's nothing that I've seen that shows that vitamin K actually creates a decalcification of an already calcified artery. In that regard, it depends on why the artery in and of itself is calcified. So like if vitamin K deficiency is the reason that you're depositing calcium into the artery, then likewise, you'd want to absolutely correct the vitamin K deficiency so that the mineral goes to the right location, which in this case typically is not in your artery, but in your bone. But there are some other reasons why you might have calcium deposition in your artery that have nothing to do with vitamin K deficiency. And most of those reasons have to do with inflammation. Chronic inflammation of the arterial wall can lead to calcification deposition into that wall. And so finding out if you've got a hidden source of inflammation, whether it be through food or whether it be through chemical exposure, or whether it be from some type of infection, chronic infection, like those are some of the big reasons why we might see somebody have chronic inflammation in their vascular tree. And finding that out is the most important step at trying to get to the bottom of the problem. How do you rectify a vitamin K deficiency if you do not have your gallbladder There's a couple of different ways that you can rectify it. One, you can take a strong enough dose where you induce something called passive diffusion absorption, Leanne. Passive diffusion means that the dose of the vitamin K that you're taking orally is great enough to be passively taken through the small intestine, and whether you have bile or whether you don't have bile. So that's one element, or that's one component of how it can be done. The other way is you can use an emulsified version of vitamin K. So a vitamin K that's already bound and emulsified, and in that way it's absorbed even though you might not have a gallbladder. The other way is to take ox bile supplementation, meaning to take a supplement that contains a bile acid substitute, so that when you eat your meals, you take that about 10 minutes before you eat, and that bile will act as a bile substitute for you, helping you to emulsify the fat in your diet. Now, remember, just because you don't have a gallbladder doesn't mean you can't make bile, and mean that you don't have bile in your small intestine. It just puts you at a disadvantage. So it's important to understand it's not an all or none proposition. Therefore, if your gallbladder is removed, it doesn't mean that you can never absorb any fat. It just means you're at a disadvantage. Marie says, hi, is the vitamin K vaccine given to newborns really necessary or even advisable? You know, it's one of those that as a parent, you've got to stand up and make a decision for what it is that you want to do. I generally try to educate people. I don't tell them whether or not to stick a needle in their kid, but I try to educate them about what the potential risks and downfall to that are. With vitamin K, it's a little bit less risky than, say, some of the other vaccines that we know can contribute to autoimmune disease. But to me, why run the risk of puncturing the skin? I much prefer an oral supplementation. If you're concerned about vitamin K deficiency in the newborn, oral supplementation is something I would highly recommend over the injection itself. I know a lot of doctors would argue with me on that, but that's my opinion of the matter. What can cause too much calcium in the blood? Michelle wants to know. So too much calcium in the blood, pretty simply put, too much calcium can be caused by a lot of different things. But, you know, one of the biggest that I see that's like clinically relevant is vitamin D deficiency. Not having adequate vitamin D will pull calcium from the bone into the bloodstream, and it can elevate calcium levels. There are some other things that can affect you as well, like parathyroid problems. So if you've got consistently high levels of calcium in your blood, and, you know, one of the first things you should do is get with your doctor to rule out any kind of parathyroid hormone or parathyroid gland tumors or parathyroid dysfunction. But oftentimes it's vitamin D in my experience. Let's see here. What about vitamin D? Does it require K2 for absorption? No. Vitamin D does not require vitamin K for absorption. It requires bile acids, and it requires a healthy functioning intestine. Let's see here. What about someone that is on warfarin for blood clotting disorder like factor V Leiden? Can natural blood thinners work instead? That's something, Guero, that you really want to work with your doctor toward. If you've got factor V Leiden, you might have, that's a gene, right? So it's a gene variant that increases your risk. It increases your risk of a problem. That doesn't necessarily mean if we took everybody and genetically measured them, we'd find a lot of factor Vs out there that aren't on blood thinners. So it's kind of a gene association that doctors oftentimes use blood thinners for. Yes, natural things could work better, but if you're going to do it that way, you need to be with a doctor, working with that doctor to properly do the right lab testing to make sure that you're reaching a desired level of blood viscosity. Emily says, what's the best test to do for vitamin K deficiency? Probably internal intracellular levels, looking inside the cell to see that you've got adequate quantities. Outside of that, PTT, as I mentioned earlier, prothrombin time can be used as a general indicator. Is taking 200 micrograms of K2 MK7, is that okay? It's okay, Victoria. It's 200 micrograms is certainly not a megadose. You know, I see people on a frequent basis where we'll use 15,000 as opposed to 200 micrograms. We'll use 15,000, right, as a dose. But 200 is fine. Again, is it okay? It depends on what you're taking it for. If you're taking it to try to enhance your bone, if you're, that's where MK7 is oftentimes implicated, is in helping for bone mineralization. What about vitamin D? I think I answered that one. My sister-in-law had her gallbladder removed. Can she supplement with bile salts, or what do you recommend? She can. Anybody can supplement with bile salts, even somebody with a working gallbladder. But that would be a place to start. I mean, if you've got your gallbladder removed and you want to maximize your digestion and try to prevent a future problem with fat-soluble vitamin deficiency, and it usually after gallbladder removal, in my experience, anywhere between 5 and 10 years is where we really start to see fat-soluble vitamin deficiencies showing up in a bigger way. But yes, she could take a bile acid supplement very easy. Let's see, this is off topic, but I want to thank you for bringing us the deal on the air doctor. Oh, you're welcome. It's working really well in our home, and we can tell the difference. I love hearing that, Nancy. Thank you for sharing that with me. It just helps me to know that the information I'm trying to bring to you on a weekly basis is being beneficial. So thank you for sharing that. For those of you who don't know, we did a show a couple weeks ago on how to remove toxic debris from the air. And so one of the questions that came up was what type of filter that we recommend. And so you can go backwards and watch that show if you're interested in that topic. Let's see here. What about Capra? No, Capra is not necessarily one that disrupts or interferes with vitamin K to my knowledge. Let's see, keep going down. How much vitamin K should you take in daily while pregnant? Currently take a multivitamin. So, I mean, there's not really an upper intake level, but a healthy, safe level of vitamin K, 100 micrograms a day is really safe if you don't have any other types of medical issues or anything else going on. So think of it 100 micrograms a day as kind of a bare minimum. But if you're eating, if you're eating a lot of dark green leafies and you're eating fermented foods, you're getting lots of vitamin K. You don't necessarily need to take more. If you're trying to take more to kind of pre-plan for whether or not you want to do that injection in the hospital when the baby's born, taking more vitamin K during your pregnancy won't necessarily dramatically impact the vitamin K levels of a newborn baby. And now, again, not unless you're doing something major like inhibiting your vitamin K with a seizure medication. Can gluten cause vitamin K deficiency? Yes, it can. Great question, Lucy. Our family's grain-free, and when my 13-year-old has gluten, he'll get a bloody nose over the next couple of days. Yeah, so there are a couple of things there. This is actually, I'm glad you mentioned that. My oldest son, his primary symptom of gluten exposure was spontaneous nose bleeding. And when we stopped eating gluten, his nosebleeds went completely away. It's a very common symptom, actually, of gluten. Now, whether or not it's related directly to vitamin K, I don't think you can say that quickly that it would happen, that gluten would cause a vitamin K deficiency that quick. So it's probably got less to do with vitamin K and more to do with the inflammatory response that your son is actually having as a result of getting gluten exposure. But interesting nonetheless. Let's see, is it advisable to eat miso as fermented soy regularly to get vitamin K2? It depends. Like a lot of people are allergic to soy. Remember, soy is one of the top 8 allergens in the world. And that being the case, many people are allergic to it. Is it advisable to eat it if you're not allergic to soy or if you're not reactive to soy? Yes, provided it's advisable to eat it if you enjoy it. 2, if you're not buying a genetically modified version of soy and fermenting it, or if you can confirm that the variety that you have is organic and is not contaminated or laced with any type of chemical like Roundup, which is something that's becoming more and more a problem in processed food, even the organic varieties of processed food. Let's see here. Veronica wants to know if we're doing a replay. Oh, yes, Veronica, go check out. If you subscribe to my YouTube channel, we can throw that link up for subscribing to YouTube. If you're not already subscribed, just click this link and you'll subscribe. And so anytime we have a new video that's uploaded and in the archive, you'll get a notice and you can always watch the replay. Let's see. Mary says, have you heard that cruciferous veggies are bad if you have Hashimoto's? I recently ate a large arugula salad and weirdly developed what looked like burns in the back of my throat. My nutritionist told me that I should not be eating cruciferous veggies with Hashimoto's. That's ridiculous. If you ate an arugula salad, first of all, the arugula probably burns your throat because arugula is very, very bitter, and you may have just eaten too much. And it can be like an onion, just like an onion can burn your eyes. Arugula can burn your eyes and throat, but less having to do with cruciferous component. There are goitrogens in cruciferous vegetables. In other words, it can inhibit your thyroid from properly functioning, but you've got to eat a lot. And I mean, when I say a lot, I mean you've got to eat, a lot on a regular, consistent basis for it to have a major goitrogen effect on your thyroid. So if you're eating small, reasonable quantities of broccoli, cauliflower, cabbage, Brussels sprouts, those things, I'd probably say they won't affect your Hashimoto's greatly or tremendously. Although some people are ultra sensitive, it's not really super common. And if you cook those cruciferous vegetables really, really well, then you destroy a lot of the goitrogenic property of it. So if you're steaming them and to a point where they're somewhat soft, should be something that you should tolerate very easy without it creating a problem with your thyroid. Let's see, Linda, does vitamin D from the sun compete? No, it does not. Vitamin D from the sun does not compete with vitamin K. Linda, good point. Where the competition occurs is not, remember, the sun hits your skin and it converts cholesterol in your skin to vitamin D, which then absorbs into your bloodstream. The competition between vitamin D and vitamin K occurs in the gut itself, in the GI tract, because they're competing for the absorption. So that's to kind of understand where they compete is in the gut, not inside the bloodstream. The vitamin D that you make when you produce vitamin D from sunlight exposure goes to the bloodstream directly, bypassing the GI tract. Let's see here. Okay, does feeding grain to my farm-raised animals that I consume, is that bad for me? And if I started feeding them a grass-based diet, will it make them safe to consume, and how long to clear them out? So let's talk about that. So it depends on what kind of animals that we're talking about first and foremost, and what aspect of the animals you're eating. So like if you're talking about chickens, for example, chickens are capable of eating seeds, which is what grains are. Grains are the seeds of grass. Chickens are capable and genetically adept at eating seed. So if you're feeding your chickens grain as a substitute, but also allowing them to free range and free roam, there's no harm, no foul. Foul, right? Anyway, my point is you don't have to so much worry about that in terms of your chickens, but the grain needs to be organic, because the problem with a lot of the organic or the non-organic feeds is that they've got chemical pesticide in them, and you don't want that showing up in your chicken meat, and it will. If that's the case. As far as the chicken eggs, no, you don't have to worry about chicken eggs either. So chicken eggs and chicken meat, you don't have to worry about gluten per se showing up in the meat or the egg if you're feeding them or supplement feeding them with grain. But again, you want to allow them to free range. Chickens are not designed to just solely eat grain. They eat bugs, they eat worms, they eat grass, right? A lot of the rich carotenoid, the rich yellow, orange color of the yolk comes from the grazing, and that's where a lot of those nutrients that you're going to consume come from. As a matter of fact, egg is a great source of vitamin K. Since we're on that topic, we didn't really mention that earlier, but it's a great source of vitamin K from animal base. As far as pigs are concerned, pigs are more suited for free range and less suited for grain. If you're using a lot of grain with the pig, you're still not going to get gluten, but you're going to eat meat that's marbleized with heavy quantities of omega-6 fatty acid. So remember, omega-6 fatty acid competes with that omega-3. And if you create a big imbalance from omega-6 to omega-3, you can actually end up creating a scenario where you have a problem with inflammation as a result of too much omega-6 fat. So from that perspective, don't really recommend doing heavy quantities of grain-based feeds in your pigs. They should be more free roaming, if that makes sense. And how long will it take if they're already mainly grain fed? How long will it take? Well, I would do it at least as a minimum. You know, if you begin the free roaming of pigs, and a lot of people want free range pigs because they tear up the property. They'll root. They will root up the trees. They will root up the dirt, and they will make all kinds of a mess. So it just depends on what you've got set up. But I would give it at least 3 to 4 months to get them exercise, to get them sunshine, and to get their diets a little bit more managed. So if one got second-degree burns, should they back off of C and magnesium if it thins the blood? No, not necessarily. Just because you get burns doesn't mean that you're not going to thin the blood so aggressively with magnesium or vitamin C that you create a scenario of hemorrhagic effect. The point I was trying to make earlier is not that you really want to use magnesium per se as a treatment to thin your blood. You want to make sure that you have adequate magnesium, because magnesium inhibits platelet aggregation. It's one of its functions. If you haven't watched, I did a full show on magnesium where we talked about this, but magnesium prevents your platelets from becoming too sticky. It doesn't actually thin your blood and make it too thin, but it prevents your platelets from being too sticky. A lot of people that end up being on warfarin, it's because their diets are highly processed and they don't get enough magnesium, and so their blood is naturally thicker, and it increases their risk for developing a stroke or a heart attack. So instead of the doctor saying, oh my gosh, you've had a stroke, let's change your diet and let's make it make sense, they say, no, let's go complete 180 and tell you to eat no greens, but let's jam a very, very powerful medication into you, so that we block all vitamin K activity so that your blood runs like water. That, to me, it's going from one extreme to the other, from a bad diet to bad drugs. Let's not go from a bad diet to bad drugs. Let's go from a bad diet to a good diet, intelligent exercise, intelligent behavior, so that your blood is naturally thin as opposed to naturally thick. Hopefully that helps clarify it. So no, you don't have to. As a matter of fact, if you've got second-degree burns, 2 things that you should be doing. Number 1 is L-glutamine, and number 2 is vitamin C. And I would say, I don't know how much you weigh or how big or tall or whatever you are, but an adult, 150 pounds, vitamin C about 5 grams a day, and L-glutamine 3 to 5 grams a day as tolerated by the bowel. Works really, really well to help with burns. As a matter of fact, I did a show on L-glutamine, I believe it was a week or 2 ago. You can go back and watch that because we talked specifically about burn recovery in that show. I mentioned cheese as a source of vitamin K. Is there a healthy cheese that I would recommend, or is cheese not a good food choice? Depends. Again, just like soy, dairy is one of the top 8 allergens, and so it depends on whether or not you're reactive to dairy. If you're choosing a cheese, if you're not reactive to dairy, and if you're beyond it, so like if you're following no grain, no pain, just don't even worry about dairy, especially if you're trying to overcome chronic pain or chronic autoimmune inflammatory problem, keep dairy out. But if you're beyond autoimmunity and your health is really, really good and you're trying to introduce a form of dairy into your diet, the best type of dairy to really make that attempt is A2A2, meaning the animal should be genetically tested and make sure, if it's cow's dairy, for example, that the milk is A2A2. It's a genotype. The type of casein from A2 cows doesn't stimulate the autoimmune process the way that casein from A1 cows does. We learned that with the Maori tribe in New Zealand, when we found that A1 milk actually increased the likelihood of the development of type 1 diabetes in those individuals. Can vitamin K help improve eye strain and sight in general? No, not to my knowledge. There's no research that shows that vitamin K improves eyesight. Again, that doesn't mean we won't maybe do a research study in 10 or 20 or 30 years and find that it could potentially have that possibility, but nothing that I'm aware of to date. Let's see here. Nancy, I'm thankful for your help on ALT. We have fatty liver in my family, lots going on in my body, and you have really saved my life. I hope so. I hope that that's helpful for you. Thanks for the comment. Let's see. Barb wants to know, can eggs be consumed daily? They have so many beneficial nutrients and easy protein source, but my doctor said 2 per week only. Your doctor needs to go back to nutrition school. There's no research at all that says that eating eggs is bad for you. As a matter of fact, if your doctor's talking about cholesterol, which I would assume that he is, although I don't like to make generalized assumptions about what other people are thinking, but that's most likely why you were told that. Look, the fact of the matter is cholesterol has nothing to do with heart disease. I know that maybe for some of you tonight, that may be either making you mad or it may be like blowing your mind. But if you haven't heard me talk about cholesterol, you need to go back and view my archives. But no, 2 eggs a day would be perfectly fine. 2 eggs a week is that's fine too, but you don't have to limit yourself. I think I talked about factor V Leiden already, so I'll skip that question. Let's see. For surgery, should I increase vitamin K to reduce bruising? No, not necessarily. If you're planning a big surgery, so like if you're planning on going in like major hip replacement surgery or some type of major where they're going to cut and you're going to lose a lot of blood and it's going to require a lot of rehab afterwards, for that, I would highly recommend that before you go under the knife, you absolutely ask your doc to test you for vitamin and mineral deficiencies. Because remember what surgery is. It's scheduled trauma. You're basically planning to go and injure yourself in the hopes that you're going to help yourself in another way, right? And so if your body is already struggling to the level that you need a surgery, it's probably because you're malnourished in some way. So before going and having more trauma done to your bodies, measure your nutritional status, because you want to go into that surgery knowing what your low end, so that you know exactly what you need to take, so you know exactly what to give your body more of, so that you can give it what it needs to support the healing process. What's helpful for fatty liver? Michelle wants to know. Well, lots of things, Michelle, but predominantly fatty liver. It depends on what's causing it. So the most helpful thing for fatty liver is to find out what's contributing to it, so that you can stop whatever that is that's causing it. Because so many people out there doing detox, detox the liver, detox this, detox that. Look, what is a detox? A detox means that you're taking away toxins, but where are those toxins coming from? So before you do a detox, ask the question, what's making me toxic? And don't just give yourself a generic answer like we live in a polluted environment or we have polluted air, because you can filter your air, you can filter your water. That's how you detox every day. Your body is a detoxification machine and it knows how to detox. It's only when it's overwhelmed that you can start having problems. So before you do a detox for your liver or take a supplement for your liver per se, ask a deeper question. Why is this thing breaking down, or why is this problem happening? Okay, I think we're out of it. We're out of time. So a lot of you, there's still additional questions. Make sure you tune in next week, folks. We're going to be back next Monday, 6 p.m. Central Standard Time. Again, thanks so much for spending part of your Monday with me. If you want to get more information, you can go over to glutenfreesociety.org. Sign up for our #1 newsletter. It's the largest newsletter for a gluten-free diet and lifestyle in the world. And sign up for our newsletter. We'll send you a free gift, a gluten-free survival guide on how to navigate the gluten-free diet in the proper way. As well, if you haven't already, go get your copy of No Grain, No Pain. It's the kind of the platform of education. If you read that book when you come back on Monday nights to do these crash courses with me, you'll get so much more out of them with that baseline of information. So again, thanks for tuning in with me tonight. Hope you have an excellent week. We will see you next Monday, 6 p.m. Hey, don't forget to tune in next week, same time, 6 p.m. Central Standard Time, for another Pick Dr. Osborne's Brain show. Bring all your toughest health questions to me. I look forward to answering them. And before you leave today, make sure you hit subscribe. And once you do, click that bell. That bell is going to allow us to remind you right before we go live. But it's also going to allow us to remind you when we come out with other video content all week long. We've got lots of episodes coming your way all week long, and I don't want you to miss anything. So again, subscribe, hit that bell so that you can get notified when we have that new information put up for you. Thanks so much, and I'm wishing you excellent health. Have a great week. We'll see you next Monday night.